I treat kids at higher levels of care at Rogers, which is what we do as child psychiatrists here. It's not uncommon for them to have been through some medication prior to getting to see someone like me. It's common for us to go through, we want to hear that medication history that they've had. And sometimes families will say, they've been through so many things and none of them have worked. So it's critical that we get a really detailed history around that. And common things that we'll see are, one, that the SSRIs that they've tried, so the selective serotonin reuptake inhibitors, have been underdosed. So they just haven't gotten high enough in the dose. Or they've been sitting at a low dose for quite a while. So they might show up to me and they've been on sertraline, which is the generic form of Zoloft, also indicated for pediatric OCD, and they've been sitting at 25 or 50 milligrams for months. And we know in the largest pediatric OCD trial that we have available to us, sertraline on average was dosed at 175 milligrams. So that's really common for us to see that it's underdosed. Perhaps it wasn't what we would consider to be a long enough trial, so maybe they were only on it for 4 weeks and then they moved on to something else. The other thing that's becoming increasingly common for us to see is something where patients have gotten gene-drug interaction testing. And so a variety of companies do this, and it'll give you information on how your body metabolizes or handles medications in different ways. And there is some useful information that can be taken from these gene-drug interaction tests, but also there's some information on there that hasn't been scientifically researched enough, but it's still being put out there. And so particularly in the child and adolescent population, what often happens is the newer medications are designed to be easily metabolized in our body, right? We've gotten smarter with the science that we know. And so they end up being in this category of saying, we can handle those. Those medications have often not been studied in kids. They often have not been studied in OCD, but the child is on that particular medication because the gene-drug interaction testing is saying that their body would handle that best. And so we really have to do a lot of education around that as well, because gene-drug interaction testing can inform us on things, but it shouldn't drive us to use medications that we know haven't been studied in the way that they, to know, is it going to work for OCD? Is it going to work in a child? And so child psychiatrists, you'll see we tend to use drugs that have been on the market longer because we need the research in kids to know that it's safe, that it's helpful. And with the newer ones, we just don't tend to have that information. So I do have to, I often have to talk to families about that. Oh, we should actually use something over here that it says your body might metabolize a little differently, but that's okay. We can just dose it a little differently, or we can do some other things to help. So we have to do a lot of that education as well, so that we're not actually using a drug that we know doesn't have studies in it to actually help.